We are seeing some high occurrence rates locally where we're out of. And we are seeing some very small batches of the COVID-19 vaccine. When can we expect to see more of those vaccines reaching us?
Well, I would love to see more vaccine coming into Ohio, but we have the same problem every state does. There's not enough vaccine. So, we vaccinated about 350,000 people in Ohio so far, and we've really set the priority of how can we save the most lives as quickly as we can. 86%, 87% actually of the people who have died in Ohio from COVID have been over the age of 65. So we know that that's where we have to go and protect them. Over half the deaths in Ohio have come from people in nursing homes. So the good news is we have now vaccinated about 90% of our nursing homes for the first dose, and we've started on the second dose on many of those nursing homes. So we're very happy about that, where we are in regard to that. Our other goals are to get kids back in school, and we hope to start vaccinating people who work in our schools, our teachers and the custodians and other ones around February 1st. And our third objective, of course, is to vaccinate our first responders, our medical people who are working directly with COVID patients. And that has been going well. Next week, we start on Tuesday, Wednesday, and Thursday in Ohio. We start vaccinating those people 80 years of age or older. And so today and tomorrow, local health departments will be announcing where those locations are in their individual communities. So many times it's the local health department, might be the local hospital, it might be the local pharmacy. So every county will have, several bigger counties obviously will have more, but every county will have a few locations and people will be able to sign up there. But we still, we don't have enough. Next week, for example, as we kick off 80 years of age or older, we probably only have enough vaccine for about a fourth of those individuals. We have about 100,000 doses that are coming into Ohio next week for those individuals. But the population in Ohio of those 80 years of age or older is 425,000. So it's a national problem. We don't have enough vaccine, but we're targeting it directly to people who are the most vulnerable, the most likely to die if they do in fact get COVID.
Now, you mentioned our schools, and we are getting a lot of calls here, and as I'm sure throughout the country is happening, that kids are struggling. They are falling behind. So when kids do get back into the classroom, how are we going to make up for that lost time?
I think it's, first of all, very important to get our kids back. Now, some schools have been in person all year. Others have done a hybrid where they're in for a couple of days a week, and others have been totally remote. Our goal is to have every child in the state back in school in person by March 1st. And to do that, we're going ahead and vaccinating, teachers and others who work in the school building is really an incentive to be able to get these schools going back. But we also will have to catch up some in the summer. We're going to be working with our schools to, provide that opportunity for many students. Some kids do well remotely. I've got one granddaughter who loves it, but I've got some other grandkids who don't like it as well. And some kids do well, some kids do okay. And we've got some who just don't do very well remotely. And frankly, those are the ones that we really, really worry about. We want to get them back in school.
Absolutely. Okay, so moving on to kind of our restaurants and bars. Clearly, they are taking a hit during this pandemic, and one thing that they kind of correlate with that is this 10 p.m. curfew. And where we're located, a lot of business now is traveling into West Virginia to go to bars and restaurants late at night. So I guess my question is, what data is dictating that 10 p.m. curfew that is still in effect?
We put the 10 p.m. curfew in effect at the same time that we started really enforcing the mask order in retail establishments. And we've seen the compliance go up to about 95% in our retail establishments. So those two things together slowed the increase. In fact, we've kind of leveled off. We're at a very high level, but it really did slow things down, and we think it's been effective. The science behind it is pretty simple. The challenge with a restaurant and a challenge with a bar, and our folks who run the restaurants and bars are doing a good job. They're doing the best they can. But the nature of that business is that you cannot wear a mask while you're chewing and eating, and you cannot wear a mask when you're drinking. And we know that that's where we see spread. When people are with people who are not in their family, in a room, we see spread, particularly in the winter. And so it's cutting down simply on the hours of exposure. We had some states have totally closed bars and restaurants. We've had other states that did it for a period of time. We said we're not going to do that, but we are going to compromise and try to protect people, but at the same time, understand that small businesses have to try to continue to go. And so we came up with the 10 p.m. curfew really as a compromise.
Now, is that something you could see your team reassessing in the near future? What is the timeline when it comes to that?
Well, I would love to get rid of the curfew. I'd love to get rid of any other, order that's out there. But we're seeing a very high rate of spread. There's no county in the state, 88 counties. Every one is a very high rate. A third of our people who are in ICU in the state and all our hospitals, a third of them are COVID patients today. So, we're concerned about that. We saw a new variant that's been discovered by Ohio State today. We're worried about that coming into the state, and that is even more contagious than, what we have seen so far. So we're vaccinating people. Fast as we get the vaccine in, we're getting it in people's arms. We're doing that at the same time. We're trying to continue to hold back the COVID and slow the spread. And these are things that we have to do at the same time. So we're not out of this yet. 2021, I think, is going to be a good year. It's going to be a year of recovery. It's going to be the year that we look at this virus in our rearview mirror, but we're not there yet. And we gotta hang in there until we get there.
Now, picking up on something you've talked about over the last 2 weeks, you mentioned our nursing homes, and you guys have great success in vaccinating your residents, not so much your staff, although you said it is getting better. So what are you seeing this week, maybe compared to last week?
Well, I don't have the numbers, but the people who are doing the vaccinations are telling me that when they go back the second time into the nursing homes, they are picking up more staff. So we started the first round with about 80% of the residents getting the vaccine and about 40% of the staff. Now, this is individual choice. We're not compelling anybody to take it, but we know that this is where we've seen the most deaths. 54% of the deaths have come out of our nursing homes. So it's really important for the residents to take the vaccine. And I would just say, if anyone's watching this who has a loved one in a nursing home, please urge them to get that vaccine if they've not done so. So when they come around, tell them to say yes, because they're really the people who are the most vulnerable in all of the state. And for them to get that vaccine is just a really good thing.
Now, I know you can't read minds, but do you have any sort of indication as to why those staff in the nursing homes are denying that shot?
No, I think there's a feeling, there was at least for the first few weeks when this vaccine came out, people were saying, well, let's wait, let's let other people try it and let's see how it works. And so that, that's taken place. Some weeks have passed, and, there's been a lot of people who've gotten the vaccine across the country. And so we just encourage people now, if you're waiting, that's fine, but now's the time, particularly in the nursing homes, when they come back and offer you this is a great opportunity for you to get it.
Now, moving on to unemployment. Locally, we have had a few calls recently from residents in Jefferson County that have still not received unemployment payments from back in the spring. Do you think it's acceptable that people are still waiting on those payments? And what can the state do better moving forward?
Yeah, they can certainly contact me. They can contact our team, and we'll try to run these things down. The federal law requires on unemployment for there actually to be verification. So it's not just a question of applying and then you get the money. That's the way it is with some things, but with unemployment, you got to go through the verification process. And so we apologize for people not being able to get it. A lot of people have gotten it, but we also know that there are people out there who have struggled and things have not moved as quickly as they should. So, our team is working on that, and I apologize. I know that must be horribly frustrating to people.
So what is your advice then? Because I know that I talked to the Ohio Department of Job and Family Services about this. They're saying, be patient. These residents are calling, told to be patient, but now they've been waiting for 10 months. So at what point is kind of the line drawn and can something get done? I know it's difficult, but.
Look, if somebody's waited that long, they should contact me, the governor's office. I mean, they should get into our office and into our system, send us a letter there. That should not be taking place. People should not be waiting that long. Many times there's some reason why that has taken that long. So again, without knowing the individual case, I have no way of running that down. But I know that people have waited, and we apologize for that.
I just want to ask you then, what is your advice and what is your message to people in Jefferson County, our rural counties here? What would be your message to them as we kind of now are out of the holidays and we start to move forward with the vaccine here?
Well, my advice to people in Jefferson County and any other county really is that we're going to come out of this. This is going to be a better year, but we still have widespread virus. People still need to be very careful. They need to wear a mask when they're out in public. If you're eating with someone and they don't live in your house, that's probably not a good idea. It's not a good idea. If you're drinking with someone that doesn't live in your house, that's not a good idea. You should try to keep that separation. Basic things such as that. As far as the vaccine, it's coming. We're trying to do it in a logical way. We don't have enough of it, so we got it first in our nursing homes. And at the same time now, next week, we're opening up to people 80 years of age. We know that 87% of all the deaths that have occurred from COVID have occurred for people 65 years of age and older. So that is the target population that we're trying to get shots in their arms just as quick as we can. And my commitment is that as soon as this vaccine comes in every week, we're getting it. It's going right out. And it's going into Jefferson County and it's going into every other county of the state, but it's not enough. And we understand that it's a scarcity, and we're trying to, again, target that for the people who are the most vulnerable, that if they get the COVID, they're more likely to die than other people. And that basically is the older people in our communities.
And then my last question for you here today is, I know you activated 580 Ohio National Guard soldiers. What is your concern kind of heading into next week, and what is being done to protect local communities throughout the state of Ohio?
Well, what we saw in Washington was horrendous, really an assault and attack on our liberties, assault and attack on the Constitution, on the Capitol. People died as a result of that. So we want to avoid that in Ohio. We know that they've targeted, state capitol buildings, for example, and we have the Guard that's ready to go. But the Guard is also ready, always is ready. If we have a problem, any kind of problem in any part of the state of Ohio, the Guard can be there. We've seen floods along the Ohio River. We've seen tornadoes in Western Ohio. The Guard does a phenomenal job. And frankly, during this virus, they've been out working with food banks on logistics, been very, very helpful. They have been doing testing. They will be doing in the next few weeks, starting to do some of the vaccinations at some of the bigger sites. You'll see the Ohio National Guard doing that as well. So these are citizen soldiers who do a phenomenal job to protect us.
Thank you so much for your time today, Governor DeWine. I appreciate you talking with me, and stay healthy and safe